Hey, what's up everybody? So we are on the Wild Roots Wellness Facebook page. I haven't gone live here. I don't even know if I've done live at all really here. But anyways, I'm going to be discussing today, I'm going to be talking about celiac disease, its connection to liver dysfunction, giving kind of a case report on one of my clients and the benefits she's seen, and will basically be hopeful for the benefits of this diet and lifestyle and treatment plan for her future health. And also, I think this has application to many women out there who are dealing with chronic female-related disorders. And so we will be giving you access to research articles here, or I'll be bringing them up and showing you from peer-reviewed medical literature how I believe that many women especially, are being brushed aside and being given medical treatment, pharmaceutical treatment for symptomatic illness and disease, let's say birth control medications, or an IUD for menstrual irregularities and severe pain and bleeding conditions, things like that, or individuals being given pain medications or epileptic medications, or even and things like that for severe migraine and headaches and things like that, inappropriately, when there's actually a testing that can be done to effectively determine if somebody is dealing with those issues because of or potentially because of celiac disease. And the reason I say it that way is because, even if a test comes back positive for an indication of celiac disease, or a full-blown diagnosis of celiac disease, and they're dealing with menstrual irregularities, they're dealing with IBD, inflammatory bowel disease, IBS, irritable bowel disease, migraine headaches. If they're dealing with these things, you can't say for 100% sure just from that test that those issues were stemming from the celiac disease itself, the autoimmune response to gluten or gliadin. But if you take and apply the quote treatment for celiac disease, which is going to be just the elimination of anything containing gluten or anything that is prepared in a pot, pan, or machine container containing gluten, so that you have zero exposure, hopefully, of gluten whatsoever, gliadin whatsoever, that is the treatment for it. And if the results show you that you see a reduction in inflammation, joint pain, inflammation, you see an improvement in menstrual problems, you see a normalization of menstrual cycle, there you have it. You can then hang your hat on the treatment was the test, really, for whether the symptoms, again, the various symptoms that go along or are associated with celiac disease, a gluten sensitivity or gluten severe allergy, autoimmune response, you can hang your hat on, well, the cause of those symptoms was the celiac. It's not the lack of a pharmaceutical medication in your bloodstream. I guarantee you that. And so we're going to be going through this. Again, this is kind of a case report from a client of mine seeing some positive beneficial responses from this dietary intervention and other interventions we have chosen to, and she has chosen to utilize in my clinic. Including in this was hyperbaric oxygen therapy because of some specific health goals that she had. So let's go through this. Another one, cool little, and I didn't even realize this. I had to look it up. She came in saying that once we had initiated this treatment, we've been going through it for not quite a month, but she's actually seen a significant reduction in her cup size in her breasts. So her bra size has gone down. Now, some women may say, I don't want that to happen, and other women may be like, that would be great if that happened for me. But this individual, once she had gone through menopause, had actually seen an enlargement of her breasts that she did not like and did not desire. She's actually seeing a firming and improvement in reduction of size. Like, I don't know how that happens. This is just what she has reported to me. And she was very thankful of that post-menopause, she saw some things that she did not like in her body, and one of which was actually an enlargement of her breasts post-menopausal. So, again, benefits, what exactly is bringing that about? I don't know, and I don't really care. All I know is she's getting the results that she is super happy about. So, but again, this is a focus on, and what I want you guys to take from this is that in my clinic, I approach the care for my clients and my patients from a cause-specific focus. and a treatment plan or a health plan for those individuals. We choose according to what is going to bring about the result they desire without saying, let's just add a bunch of things to the body. Let's take a bunch of herbal recommendations and obviously not pharmaceutical recommendations. But what I'm trying to do with each one of my clients is say, can we discuss and talk about and utilize testing to identify what is the most likely cause of your situation? This client's situation also brought about me to dive into more research and to really look at the effects of, celiac disease. When we did the stool sample, the results brought me into this realm of, okay, she's been having irregular test results with her liver enzymes. And she had been seeing a medical physician. And this medical physician is more alternative, but still medically minded, it seems, because they were trying to treat her elevated liver enzymes and fatty liver or liver dysfunction with more of like a supplemental support, not medication, but more supplemental. And they're like monitoring, and she had elevated liver enzymes for a long period of time, most of her life. And they never found out what caused it. And so we're hopeful. We have not decided yet at this moment in time to do liver enzyme testing again on her. But the association between elevated liver enzymes, liver dysfunction, and celiac disease is well established in the medical literature. So therefore, our hope and prayer and desire for her, the outcomes, are to see those liver enzymes come back into normal levels without the need for additional and ongoing supplementation support. Now, could we utilize supplementation in certain herbs like dandelion root, St. John's wort, milk thistle to help heal her liver more rapidly? But again, the lack of those herbs are not necessarily the cause of the liver condition, though those herbs are very supportive in liver function. We want to identify what the cause is, because that is ultimately going to bring about the best results for somebody to get well, stay well, and be independent in their own health. Ladies, you'll like this. This is a great article from the NIH Public Access, so you can access this for free. It's Women Health. So you have celiac disease, an unappreciated issue in women's health. See, a lot of women are dealing with, again, going through migraine, headaches, hormonal disturbances, infertility, inflammatory bowel conditions, IBS, irritable bowel disease. They deal with arthralgias, so that would be like arthritic pain or muscle pain, such as situations of fibromyalgia. It's highly associated, in my opinion, clinically especially, with fibromyalgia and celiac disease, or at least a gluten sensitivity and food allergies. But it's an underappreciated issue. So because women will come in to their OB and have irregular cycles and severe menstrual pain, and yet the OB never tests them for celiac disease, but ultimately that should be one of the things that is done when women is dealing with a menstrual problem or even infertility. So I'll read you some of the highlights here. And again, I do have another channel over on Locals where we put a lot more information, things that we can't talk about here on the Wild Roots Wellness Facebook page, as we want to avoid censorship. But at that page, we also give you PDFs with the research documents, links, and everything like that for our supporters over there, where it makes it easy to access this for yourself quickly. So, celiac disease has been increasingly recognized to encompass a wide variety of manifestations. So those are the symptoms that would come about because of it that are relevant to women's health, including infertility, adverse pregnancy outcomes. So in essence, if you've had multiple adverse pregnancy outcomes or loss of a child, you know what? I would say that it is highly likely that we would want to test the individual for celiac disease or other food allergies to see if we are triggering enough inflammation in the body where the body would have to undergo a loss of pregnancy. So reduced BMD. Currently, celiac disease is underdiagnosed, largely owing to the lack of recognition of diverse manifestations by general practitioners. That's a point there that I'm trying to make, is that I see way too often, even in the natural health realm, that physicians still wish to go after the treatment with herbs, supplements, or medications. They go after the symptoms rather than seeking out what could be the underlying cause of this person's symptoms and suffering. So who would want to get tested for celiac disease? Who would this be applicable to? What does the research show? It shows that current indications for celiac disease testing in the general population include chronic intestinal symptoms, past or possible diagnosis of irritable bowel syndrome, unexplained weight loss, iron deficiency anemia. I've seen multiple people who have gone to specialist endocrinologists and sadly never been tested for celiac disease until I recommend it, and then find out that their iron deficiency and anemia was ultimately caused by the ingestion of gluten and wheat products, and once the elimination, no longer chronically anemic. Again, this is stuff that I help my clients with all the time. Unexplained vitamin and mineral deficiencies, again, because it can cause inflammatory issues within the GI tract. When that occurs, your intestinal tract will not function appropriately or at its best to be able to absorb, digest, and absorb the nutrients you need. Osteoporosis in males and premenopausal females, secondary hyperparathyroidism, unexplained elevations in liver function tests. This was specific to my client here. Certain genetic disorders, quote unquote, Down syndrome, Turner syndrome, things like that. So those would be genetic conditions, but it is a higher prevalence in those individuals that they would have celiac disease. So if you want a child or a family member who has Down syndrome, a testing for celiac disease and then elimination of gluten is not going to reverse Down syndrome. I want to be clear because it's amazing to me how many people sometimes misconstrue the statements I'm making. But if you want a child who is healthy as possible and that child has Down syndrome, guess what? If they're having especially gastrointestinal symptoms, you better bet I would want, as a parent, to test them for celiac or just use a treatment as a test. So all of you out there, it doesn't even take all the time testing, spending money there. Sometimes let the treatment be the test. That's one of the gold standards that I utilize in my clinic is, hey, we can either spend money if you need a piece of paper saying 100% you have the condition, therefore it's going to motivate you to apply the intervention, which is to not eat gluten. If you need that, then the money's well spent. If you are somebody that can say, I can do without, let's just eliminate because it's not an essential food, all right? The nutrient density of fruits and vegetables and healthy organic meats is way superior than it is to grains. So you're going to get way more nutrition from other things if you eliminate gluten from your diet, grains, and things like that. So, and I'm not saying that gluten-free is nutritious all the time because I joke around. I say there's a lot of junk out there on the shelves of grocery stores and different places that is quote-unquote gluten-free, and sometimes it's just like the quote-unquote healthy person's junk food. And in essence, it's still junk to your system, even though it's gluten-free. And I laugh when I see, I don't know if you've all seen this out there or not, but when you see hey, tomatoes, they're gluten-free. They're labeled gluten-free. I'm like, yeah, tomatoes are always gluten-free. I don't know why you would. It's not like you have a special, strain of tomatoes that are gluten-free. Yeah, it's not genetically modified tomatoes or gluten. No. But certain autoimmune disorders, type 1 diabetes mellitus, autoimmune thyroid disease, better get tested for celiac or for gluten sensitivity. And also, even when it's not celiac, big time when it's celiac, but autoimmune thyroid Hashimoto's, in my opinion, every one of them should eliminate. That's just my opinion. I'm not giving you medical advice, but I'm saying that the benefits are so significant that I've seen clinically time and time again for individuals who eliminate gluten and grains from their diet when they're dealing with Hashimoto's. With symptoms or a change in health status, first degree relatives with celiac disease, testing of asymptomatic adults and controversial, but should be considered in the case-by-case basis if other relatives have celiac diagnosis already. Certain neurological disorders, unexplained peripheral neuropathy and ataxia, so that can be neurological symptoms, dizziness, in fact. I've seen individuals, I saw a woman with tinnitus and vertigo issues for multiple years being seen by specialists, and we tested her food allergies, and she was allergic to gluten. She eliminated it, and guess what? Her tinnitus and her vertigo completely resolved. So that's what I mean. Seek for causes of that inflammatory response in the body, eliminate that cause, and ultimately you can heal yourself. you can be healed. So, gut microbiota, a targeted approach to management of chronic liver disease. Again, this client was dealing with chronic elevated liver enzymes that had not been, the cause of which had not been determined by her primary care physician, and had ongoing monitoring and some supplements to try and help it. Again, I was glad they were utilizing supplements from an alternative approach, from a healthy approach, but that, okay, we just monitor it, we try to do that, but no further testing to try and figure out what was causing it. So here are some of the results from her stool test that we did here in our clinic. Now, she took the kit home. Just to clarify, she took the kit home. She took the stool sample from the comfort of her own home and then sends it off the lab. We analyze the results. I don't actually look at people's poop. Okay, I just want to be clear on that. So I might ask you, what's it look like? But I'm not going to look at it myself. All right? Not that I really would care, I guess, but I'm not grossed out by stuff that easy. So anyways, going on. So bacillus, so you can see some elevated levels here in opportunistic bacteria. What are opportunistic bacteria? They're additional dysbiotic overgrowth bacteria. So when they're found in elevated levels, it can be an indication of dysbiosis going on. What is that? A dysfunctional microbiota profile. So a profile that is not associated with a healthy gut microbiome. So there were some other in there. So Enterococcus faecium. Sometimes these spellings are really hard to pronounce, even for me. Staphylococcus aureus was in there. Streptococcus species were in there, and some methano bacteria. And methano causes and generates methane. So if you have a lot of bloating gas, things like that, you may have overgrowth of methano. But again, even in the healthiest 75 percentile, most people do not have hardly any detectable levels of methane producing bacteria in their GI tract. And there are certain herbs that help in bringing those down. But let's focus on what the treatment plan was for this individual. Again, focusing on the elimination of gluten and grains containing gliadin. But again, it's easily found that Enterococcus species and proton pump inhibitors are connected to the gut-liver axis, being that your gut and your liver are interacting together. Your gut health affects your liver health. Your liver health affects your gut health. So if you have a viral inflammatory condition within your liver, or you've had liver injury due to Tylenol intake, things like that can ultimately result in a dysfunctional and problem within your GI tract. So healing your liver could actually heal your gut, and then healing your gut can actually heal your liver, all right? Or they will at least support each other. But proton pump inhibitors, so decreasing acid production in the GI tract, can result in increases in Enterococcus type species. Again, this is one of the things we found in her stool samples. Again, it was a promotion of alcoholic liver disease, so overgrowth of certain bacteria coupled with the consumption of alcohol could lead to alcoholic fatty liver disease. So there's a bacterial association or bacterial strains within the GI tract that are associated with alcoholic fatty liver disease. So when you actually work on the gut health, if the person would eliminate alcohol from their diet and intake, it would definitely help their liver out and it would help their gut out. But if they have the bacteria and the alcohol consumption, it's a double whammy, increasing they kind of work synergistically to cause the liver damage. So Streptococcus as well. This is a predominant bacteria to predict the severity of liver injury in alcoholic fatty liver disease. And again, she had overgrowth of this bacteria as well. So the Enterococcus was overgrown, the Streptococcus was overgrown in her profile, and then other things in the normal flora category. So this is actually what should be in a healthy microbiome. But I want to point out specifically here, it was lactobacillus species. So if you look at the probiotics that you're taking right now, and you have lactobacillus in there, those lactose species, guess what? You may have too much of them. And that can be, folks, an indication of small intestinal bacterial overgrowth. So we did a stool sample, so it wasn't a breath test. That is the classical test for Sibo, because you need to do it that way. It's not from the back end, it's from the top end that you're testing for Sibo. So we can do that as well. But it's one of those tests that I utilize less frequently because a lot of times I can see it clinically oh, you have the symptoms, we can test if we need to, but let's just design a treatment plan that's going to improve your acid production using certain digestive bitters, using certain herbs that are going to improve pancreatic enzyme release, going to improve liver function, things like that. Or let's work on the stress responses, or let's do testing appropriately to look at inflammatory triggers that could be hindering acid production, pancreatic function, liver function, GI motility, absorption of nutrients, things like that. So, but very key component there, the lactobacillus was overgrown, which can be an indicator of small intestinal bacterial overgrowth. But also small bacterial or small intestinal bacterial overgrowth is associated with non-alcoholic fatty liver disease. So again, this lady was not an alcoholic. Okay, she had bacteria associated with fatty liver disease in alcoholics, and then she had bacterial overgrowth that's associated with small intestinal bacterial overgrowth, so Sibo, and Sibo is associated with fatty liver disease. So can you see the trend here? We're seeing a pretty clear profile in her stool results. They're saying, hey, we are seeing indication of Sibo, an indication of liver dysfunction because of the microbiome, because of the gut dysbiosis. So her gut was leading to the liver dysfunction. And then what's going on in the gut is what we need to work on and what is causing the gut dysfunction. We luckily had another indicator on the same test that showed us an indication. Now, I want to be clear that an anti-gliadin IgA, you see that the 283 was high, that marker in red, that she had anti-gliadin IgA. That is an indirect, so I'll have to jump ahead here real quick. There it is. Anti-gliadin antibodies identify celiac patients overlooked by tissue transglutaminase antibodies. So, when you do the true diagnostic testing to 100%, and my goal is not to diagnose them with celiac disease. My goal is to show them, if they need it, the possibility that they would need to eliminate gluten and then ultimately intervene with dietary changes that are more nutritious for them, better for their bodies, and ultimately if their body is responding in an immunological pattern that could indicate celiac disease, well, hey, common sense says it's not a healthy choice. Let's make healthier choices and let's do according to what your body is telling us you need to do, and let's get you well. So that is not a diagnostic criteria, so you're not diagnosed with celiac disease just because that marker is high, but it is an indication that your immune system is responding to gliadin. All right? So is silent celiac disease a risk factor for non-alcoholic fatty liver disease? Yes, they found it is. So if you are dealing with liver disorders, it may be beneficial to test the microbiome to look at, and this is the thing, you could choose to go and, hey, I'm going to get tested for just celiac. And there are tests that are just celiac disease alone. That is it. All right. And an anti-gliadin IgA may not always be elevated in people with celiac disease. So even though it's an indicator that can find people with celiac disease when other testing did not determine they had celiac disease, it can also be a marker that is low in celiac disease. So it's not a gold standard 100% you got celiac disease or you don't have celiac disease, whether that marker is high or low. It's an indicator, okay? And also there are people that are sensitive and are inflamed by eating gluten, even when they're not IgG positive for a sensitivity or allergy to gluten. They're not IgE positive. They're not transglutaminase biopsy testing positive, and they're not IgA positive. But they still negatively respond when they eat gluten, and they're still inflamed. So you have to take that into consideration. So celiac disease could be a cause of non-alcoholic fatty liver disease. So my point, why do I like stool testing? Because there are other certain microbiome profiles that are not associated with celiac disease. So it wouldn't be celiac disease, but we're kind of throwing in a marker to find that possibility. And then we can look at the microbiome and see if there's Sibo, if there's other problems that can lead to fatty liver disease that are not caused from celiac. So we got more markers than just ruling in or ruling out celiac disease. So I'm not saying run out and test celiac disease. It could be beneficial, don't get me wrong. But what would be better and more cost effective is likely going to do a stool sample where you're looking for multiple factors that could be associated with a disorder or illness. So High prevalence of small intestinal bacterial overgrowth in celiac patients with persistence of gastrointestinal symptoms after gluten withdrawal. So there's a high prevalence of small intestinal bacterial overgrowth in celiac patients with persistent gastrointestinal symptoms after gluten withdrawal. So I'll have people that will do the elimination diet, eliminate gluten, still persist with their gastrointestinal problems, symptoms, bloating, abdominal pain, inflammation, things like that, and then say to me, well, doc, I eliminated gluten. It didn't have the effect I wanted. It didn't have the effect. It didn't have symptom reduction. Could you still be dealing with other problems that were caused maybe by the long-term ingestion of celiac or gluten, and you have celiac, but the elimination in a short-term elimination, even a short-term, maybe even 3 months, you don't see a substantial improvement? Does it mean that you don't have celiac? No. You could still have celiac, and the elimination gluten didn't fix your problems. So you see how sometimes testing plus treatment being the test, meaning that you eliminate something or you apply a treatment strategy and you see the results. But even when you do that, it doesn't always mean that you're not benefiting from it. So it's just kind of a catch-22 there. But that is why I put this in here, because you may have small intestinal bacterial overgrowth that persists even after the elimination of gluten in the diet. And then from there, if gluten elimination doesn't result in the improvements, then it may be time to say, hey, let's go after small intestinal bacterial overgrowth if your symptoms are persisting. And you could do a breath test in that situation if you wanted confirmatory testing to see if you have Sibo. You could do that. Or you could, again, let treatment be the test. And it's kind of, some patients weigh the cost-benefit ratio of, well, what supplements cost? What does testing cost? What happens if I do the treatment and I don't have Sibo? Am I going to be harmed by the treatment? No, in those situations, at least not in my clinic. Now, if you're taking an antibiotic, broad-spectrum antibiotic treats Sibo in medical physicians' clinics, you may have negative effects by attempting Sibo treatment through an antibiotic, because that's typically what they do in a medical physician's office. So that's just FYI. Sometimes you need to go through the elimination of gluten because you have celiac. You don't get massive improvement from that alone, and then you need to go through herbal treatments, organ supportive treatments to eliminate Sibo in the first place. Because I put out on Instagram in the past, I put out a graphics on the fact that acid in your stomach, proper acid production, that's why Sibo is associated with small intestinal bacterial overgrowth, is associated with proton pump inhibitors or acid blockers, the purple pill, Nexium, things like that. So acid production is critical. Pancreatic enzyme production is critical because you need to break down that food. And then the liver function, gallbladder, bile flow is critical to sterilize. So all of those things, enzymes, pancreatic enzymes, acid, bile, all are necessary in the small intestines to help keep it nice and clean and without bacterial overgrowth. So if those organs aren't functioning well, you may need to support those organs to take care of the cause and fully heal from it, rather than taking herbal treatments or like an antibiotic to just wipe out the bacteria. Now, wiping out the bacteria may help you get well, and then you need to work on the organ systems that allowed it to develop in the first place. Does that make sense? I hope and pray that makes sense to all the listeners out there. Give me some likes and love there on Facebook if you would. Algorithms love comments, and they love the heart, I believe, symbol. So if you would give me that on Facebook, get a little bit more traction on these videos, I would greatly appreciate it. And if you have any questions, I'm live. I am keeping an eye on my phone right here to see if there are any questions there. So go ahead and give me any questions if you have any. Anti-gliadin antibodies identified. I already went over that one. Let's move on. Now, here's another thing that we want to look at. Now, I could go through the research I have on liver dysfunction, chronic liver disorders, chronic liver inflammation, and the risk of Alzheimer's and dementia. But I'm not going through all of that today. But another goal for my client was that she could stay as sharp in her mind as she possibly could throughout her years. Again, this postmenopausal female, and she wants to stay as sharp as she possibly can. So that's where we discuss the benefits of things like hyperbaric oxygen therapy. We I talked to her about grain brain, great little book talking about grains and the effect, negative effect on the brain, cognitive impairment, and celiac disease. And that's the thing is, I said, now she did not tell me right off the bat that she had enlargement of her breast size, increase in cup size quite significantly. It actually was postmenopausal. So that wasn't like one of the details of her health history that I was taking into account when I was saying what is going to be the strategy to help this person reach the health goals they have. And some of them are the restoration of health. Again, with her case, she wanted to see improvements in her liver function since she had been treated, quote unquote, alternatively by a functional medical doc. And it's just something they missed. They were using supplements that were non-harmful but supportive and probably reduced the rate and risk of further and greater liver dysfunction and disease. But identifying the likely potential causes of her condition and liver problem is what is best for those clients. And that's what I feel I try to do differently than other health care coaches and practitioners out there. So, and there are others like me. I'm not saying I'm the best and the only one, but would love to help anybody I can. Cognitive impairment, celiac disease, she did not want it. She had a family history of Alzheimer's disease and other things. She'd seen people go down that path, and she did not want to get there. So that's where it gave her further incentive to say, hey, even though I'm not 100% guaranteed I have celiac disease with this marker, all the indications say it's best if I eliminate it. And she has, and the results have been a reduction in inflammation in her body, reduction in breast size, because it was not a beneficial thing for her. It was not a good thing. It was a body image she didn't like. And then also reaching that future goal of not having a declining mental health status. So appreciate you all. Love you all. See if there are any comments here real quick on the chat. See a lot of people tuned in. Got any questions, comments? Give me those right now. I've seen somebody say, hey, love the information. Absolutely. All right, well, cool. No questions, no comments. Got them, throw them in here real quickly. Otherwise, I'm going to sign off. Take this information, utilize it, share it with a friend. Hey, if you would, maybe copy the link, send text messages to somebody that you know of who's dealing with, hey, let's look at it. Somebody that's dealing with liver condition. Somebody who's let's go back through those symptoms that want to figure out why you have a problem. Again, if testing for the liver enzymes is where you're at, your liver is dysfunctional, not as healthy as it should be. Why is it there? Not just where. And that's what I see so often. People are stuck in the medical mindset merry-go-round of testing where they're at with their hormones, where they're at with their liver enzymes, their blood work, their anemia, things like that. They're given birth control medications when they don't need them for the purpose of not getting pregnant. And honestly, there are other safer ways to go about that. But they're being treated with things that would cause complications and future health problems and increase their risk of serious health outcomes versus getting the appropriate testing and the appropriate doctor-patient-client relationship and discussions to figure out why they're dealing with those issues. That's what I feel I do the best at. So, current indications for celiac disease testing in the general population. Let's look at it. Chronic intestinal symptoms, past possible diagnosis of irritable bowel syndrome, unexplained weight loss, iron deficiency anemia, unexplained vitamin and mineral deficiencies, osteoporosis in males and females, secondary hyperparathyroidism, unexplained elevations in liver function tests, genetic disorders. Those individuals with genetic disorders such as Down syndrome or Turner syndrome have a higher prevalence of celiac disease. Certain autoimmune disorders, type 1 diabetes, autoimmune thyroiditis, relatives that have it, certain neurological disorders. So that is the list, the primary list, but take a look at this in this study again. Why, if a woman is dealing with a health condition, so many health conditions, go to this section right here on it. Right there it is. The spectrum of systemic manifestations associated with celiac disease is broad and encompasses iron deficiency anemia, hyposplenism, reduction in BMD, liver function abnormalities, neuropathies, so nerve-related disorders or pain, psychological disturbances. I've seen a lot of people over the years who have used dietary changes to improve their mood and mental health. Fatigue, chronic fatigue syndrome, myalgia, that would be muscle-like pain, such as fibromyalgia-type symptoms, arthralgias, joint pain, asthma, weight loss, bloating, abdominal pain, bowel changes, alopecia. Hey, alopecia is in the news lately, isn't it? Headaches, menstrual irregularities, infertility and even adverse pregnancy outcomes. So if you know somebody who's dealt with that or dealing with that, please, please, please do copy the link or at least tag them in this on Facebook, and hopefully we can help them get well and identify the causes, and then ultimately they can have a cause-specific focus in restoring their health, and that's ultimately what I want to do. So I appreciate you all. Love you all. We'll see you next time.